Pilipinas, usa lang bay ang radyo. DZRH Nationwide at Radyo Natin Network ng Manila Broadcasting Company. Sa Pilipinas, iisa lang ang radyo.
Manila Broadcasting Company.
Ang Dibisyon ng Biliran Alternative Learning System kasama ang buong kagawaran ng edukasyon at kaagapay ang pamahalaan ng probinsya ng Biliran ay buong pusong inihahandog ang programang pangradyo na pinamagatang Als Radyo Eskwela. Ito ay inyong mapapakinggan tuwing Lunes at Biyernes sa ganap na alas 11 hanggang alas 11:30 ng umaga dito lamang sa 103.9 Radyo Natin FM. Walang makahahadlang, walang maiiwan sa Alternative Learning System. Tiyak na may pag-asa, sama-samang lilipad para maabot ang pangarap sa hamong kinakaharap. Patuloy na aangat, edukasyon para sa lahat, sulong edukalidad. Ito ang DepEd Als Radyo Eskwela ng Dibisyon ng Biliran.
Good morning, good morning, good morning. Rise and shine, Biliran. Today is a new day. Let us face it with optimism and positive energy. Just like what a philosopher once said, you attract the energy that you give off. Spread good vibes, think positively, and enjoy life. To our dearest listeners and ALS learners, please be ready and stand by as we are going to unfold new knowledge that you will surely give fresh insights that you can use in your everyday living. I am Teacher Jake, your teacher broadcaster for today's episode. This morning, my co-anchor is Mr. Ruben Igay, my co-ALS implementer in Biliran District. Good morning, Sir Ruben. How was the start of your day? I hope your day started with a positive vibe and full of energy.
Thank you and good morning, Sir Jake. A pleasant morning to our dearest listeners and ALS learners from different community learning centers all throughout the province of Biliran. As you have said, my morning started with a positive vibe and full of energy, of course. That makes me enjoy my day, Sir Jake. I hope our listeners are enjoying theirs too. Before anything else, I want to encourage everyone to keep on listening to Als Radyo Eskwela on 103.9 Radyo Natin FM Naval Biliran every Monday and Friday at exactly 11 a.m. in the morning. You can also watch us and follow us live through their Facebook page.
What are we waiting for? I think our listeners, especially our learners, are now ready to listen to our new episode. Learners, please prepare your papers, ballpen, and modules, which were provided by your ALS implementer, because we are now going to start our discussion.
Yes, Sir Jake. For today's episode, we are going to discuss the effects of prohibited drugs on the health and well-being of a person and the community, like marijuana, LSD, shabu, heroin, and opium. Again, for today's episode, we are going to discuss the effects of prohibited drugs on the health and well-being of a person and the community, like marijuana, LSD, shabu, heroin, and opium.
Are you now ready to listen and learn, our dearest listeners and ALS implementers? That is nice. Now, let us have first the mechanics of our game called Tanong Ko, Sagot Mo. Before we start our main discussion, we'll read the question first and you must take note this question. Once you know the answer, then you can send it to us through these numbers 0912-49022253 or 0930-777-2662 together with your name and address. You can also send your answers with your name and address and cell phone number through the comment box on our Facebook Live. The first person who can send the answer through text or comment on the Facebook page will win 50 pesos worth of load, which is sponsored by the District Supervisor of Kawayan District, no other than Sir Jerry Paghead. Thank you, Sir Jerry, for sponsoring our prize for today's Tanong Ko, Sagot Mo.
Again, send your answers through text on this number, 0912-49022253 or 0930-777-2662 or on our comment box on the Facebook Live of 103.9 Radyo Natin FM Naval Biliran. Are you ready? Very good. Here's the question for today's Tanong Ko, Sagot Mo. It is the process of using any drug for purposes other than those for which they are meant to be used or in excessive amount. Again, it is the process of using any drug for purposes other than those for which they are meant to be used or in excessive amounts.
So that is our question for today, guys. Keep that in mind or write it down in your notebook or paper. And once you know the answer, then text your answers to the number we have mentioned earlier or on our comment box.
Now, let us start our main discussion. As what we have said a while ago, the topic that we are going to discuss for today's episode is about the effects of prohibited drugs on the health and well-being of a person and the community. And some examples of this are marijuana, LSD, shabu, heroin, and opium. Do you know what is prohibited drug? Do you know what are the different kinds of prohibited drugs and its effect to human body? If your answer is yes, then still continue listening because we know that you can still learn so many things, new ideas, and information from this topic. And if your answer is no, then you are in the right program. So keep on listening to learn more.
Before we move on, let us listen first to a short audio clip that was taken from YouTube channel Opus Treatment, entitled Cocaine, What Are the Side Effects?
Cocaine is a powerful stimulant drug and one of the most popular illicit stimulants in modern history. Popularized throughout the 80s, this recreational drug continues to show a high risk of abuse today, despite its Schedule II classification. What are the important facts you need to know about cocaine and its abuse? Stay tuned. Cocaine's addictive grip. Uppers, like cocaine, release a heavy amount of dopamine in the brain. This is the neurotransmitter that causes excitement, euphoria, and other feel-good senses of energy. Repeated use of cocaine typically leads to lower highs, having many individuals using more to feel the same rush. With prolonged use, a person becomes dependent on cocaine, as their brain can no longer keep up with the normal dopamine production. This is where problems start. When we put harmful substances into our bodies, the brain can no longer do this effectively, so it takes in the chemical of choice as normal. Since a cocaine addict is dependent on the high release of dopamine, they physically feel a need to continue regular cocaine use. A psychological addiction happens too, as users feel a need to experience the same feelings or distractions their drug use brings. After a while, usually when the substance stops being used, is when withdrawal symptoms occur. Cocaine's side effects. Using cocaine might cause them to feel depleted, calm, stressed, lack motivation, or make them paranoid to be around other people. This effect is especially true in people who live with attention disorders like ADHD, as stimulants reverse the effect of their brain constantly seeking the need for dopamine. Even though each person might experience cocaine differently, there's a list of general side effects that come along after using cocaine. The common short-term physical side effects of cocaine use are a rapid heart rate increase, high blood pressure, and body temperature increase. They also experience dilated pupils, tremors or shakes, body twitches, and blood vessel constriction. Most noticeable is their attitude, as they'll feel a rush of euphoria and feelings of invincibility. Although the short-term effects of cocaine use might seem innocent or harmless enough, there are some serious long-term side effects that take place with addiction. A lot of coke addicts have a common long-term side effect of irritation and damage to their nose and throat. Cocaine can permanently damage the nasal passage, throat, mouth, teeth, and lungs whether it's snorted or smoked. Some extreme cases of heavy snorting can result in a collapsed nose structure. Because the body overworks to try to process hard drugs, chronic coke abuse can lead to liver damage, intestinal setbacks, kidney failure, or difficulties with other organs such as the heart or thyroid too. Those consuming it as crack cocaine may also suffer, especially from respiratory issues. Breathing difficulties, lung diseases, asthma, and COPD are possible side effects. Here's another thing. Any drug used over a long period of time can result in permanent brain damage, whether noticeable or small. Memory loss, loss of impulse control, and several movement disorders, such as Parkinson's disease, affect many long-term recovering drug addicts. Lastly, heart trouble comes with the long-term side effects for some users. Arrhythmia, chest pains, and a higher chance of heart attack or stroke have been proven to be at greater risk in crack and cocaine addicts. Recovery is possible. If there is a cocaine addiction in your life, reach out for help as soon as possible. The first step in dealing with cocaine addiction is to admit the problem. If detox is necessary, check into a hospital or detox medical center to go through proper detox. We advise a medically supervised detox where there's professional supervision and interaction with doctors and nurses who specialize in drug detox. You could also reach out to inpatient rehabs that offer constant support and education to stay sober. And we suggest seeking solid support groups or recovering meetings to gain control over the addiction. Feel free to call us at 949-625.
What was the main topic that was discussed in the audio clip? Very good. The topic that was discussed in the audio clip was the effects of prohibited drug and named cocaine on human body.
Drug is any substance, with the exception of food and water, which, when taken into the body, alters the body function, either physically, mentally, or emotionally. They include medicines that we take when we are sick, such as paracetamol, antibiotics, and many more. Naturally, drugs are used by the experts to treat diseases and prevent further damage. But some of us abuse the use of these medicines. They take more than the prescribed dosage or amount, which results to drug abuse.
Drug abuse is the process of using any drug for purposes other than those for which they are meant to be used or in excessive amounts. It is using any drugs for purposes of creating pleasurable effects on the brain. One of the most devastating truths about drug abuse is that it doesn't just affect the user, but it also affects their friends and their families. Relationships strain and trust can break over the course of the substance abuse. These are some of these drugs that are genuinely prohibited by the law. Prohibited drugs or illegal drugs affects the way our body functions, and they have different effects on people. Some makes them unpredictable and dangerous, especially for young people. Some examples of this are cocaine, marijuana, shabu, heroin, methamphetamine, and more.
Do you know that the most common drugs that are being abused by many people are stimulants, depressants, opioids, hallucinogens, dissociative, inhalants, and cannabis? It is difficult to pinpoint when recreational drug use triggers an outright addiction, but the physical and psychological risks of drug abuse are many. It is important to understand the underlying causes of taking prohibited drugs that may lead to drug addiction.
These drugs are commonly used by many people, and they are considered as prohibited drugs when being used in excessive amounts. Do you know that stimulants, or other called it-uppers, impact the body's central nervous system, causing the user to feel as if they are speeding up? These drugs increase the user's level of alertness, pumping up heart rate, blood pressure, breathing, and blood glucose levels. When abused, stimulants can cause anxiety, paranoia, psychosis, depression, heart failure, and more. Stimulants often come in pill form or even as food and drinks. An example of stimulants found in drinks is caffeine. Cocaine is a stimulant which is powder in form that is snorted. Doctors prescribe stimulants to ADHD, narcolepsy, and asthma patients because the drugs open up the breathing passage.
Opioids are powerful painkillers that produce a sense of euphoria in users. These drugs are often prescribed by doctors to patients who are suffering from intense pain, but they are extremely habit forming, sometimes even causing addiction in as little as 3 days. Opioids can be smoked, eaten, drunk, injected, or taken as pills. The most common examples of this are heroin, opium, and morphine. The risk of opioids abuse can devastate the life of a user. Other effects of opioids abuse are constipation, liver damage, brain impairment, drowsiness, cardiac arrest, pupil dilation, and sedation.
The third drug considered as prohibited when taken excessively is depressants. Like stimulants, depressants also impact the body's central nervous system, but it has the opposite effect, making the users feel as if things are slowing, so they are called as downers. Examples of common depressants are alcohol, tobacco, barbiturates, and Valium. Alcohol acts as depressants, making it popular choice for users looking to relax. Although, drinking is often associated with immediate burst of energy after a sip. The user's vital functions inevitably slowly down. While overdosing on alcohol can cause severe toxicity and even death. Tobacco as depressant. The active ingredient in tobacco is nicotine. It is a chemical that acts as a stimulant and depressant. Too much usage of tobacco can affect the increase of blood pressure, diabetes, weight gain, delirium, impaired memory, hallucination, death from withdrawal, and many more.
The next prohibited drug when used excessively is hallucinogens. The risk of hallucinogen abuse can have devastating effects that can last a lifetime. It can cause hallucinogen persisting perception disorder, also known as flashbacks. It can cause fear, distorted cognition, paranoia, psychosis, anxiety, increased blood pressure, and nausea.
Dissociative is a prohibited drug that distorts the user's perception of reality and causes users to dissociate or feel as if they are watching themselves from outside their bodies. These drugs work by interfering with the brain's receptors for the chemical glutamate, which plays a role in cognition, emotionality, and pain. Dissociative drugs include ketamine, DXM or dextromethorphan, and PCP or phencyclidine. The immediate impact on the overusage of dissociative are depression, anxiety, suicidal thoughts, speech difficulties, social withdrawal, hallucinations, detachment from reality, numbness, and memory loss.
Inhalants mostly can be found in our everyday household items. These drugs can cause brief feelings of ecstasy. Inhalants are always inhaled as gases or fumes. The highs slightly differ from inhalant to inhalants, but most abusers are willing to huff whatever inhalant they can acquire. Examples of inhalants are fumes of markers, paint thinners, gasoline and glue, nitrous oxide, aerosol sprays, room deodorizers. The effect of inhalant abuse are loss of smell, brain damage, nosebleeds, weakness, increased heart rate, loss of consciousness, hallucinations, and slurred or inaudible speech.
The last common prohibited drug is cannabis, which is commonly known as marijuana. Cannabis acts like hallucinogen, but it also produces depressant-like effects. It has a high potential for addiction, though though today it has increasing medicinal uses in some countries. Cannabis can be smoked, vaporized, and even eaten. Examples of cannabis are marijuana, hashish oil, cannabis-based medicines such as Sativex. The bad effects of too much use of cannabis are lowered immunity to illness, depression, chronic anxiety, reduced sperm count in men, sedation, slowed reaction, and impaired sense of time. Abusive use of these drugs may result to mental issues including paranoia, depression, anxiety, aggression, hallucinations, and other problems. It can also affect our physical well-being by weakening our immune system that makes us vulnerable to illnesses and infection. Aside from mental and physical well-being, it can also affect our social and emotional state. Prohibited drugs can affect our relationship towards our loved ones and our community. It can distort our interpersonal family relationship due to change of personality and behavior.
Did you get all the important information that we have discussed? Very good. But before we move on, let us have first a short recap. Drugs are substances other than food or water that are intended to be taken or administered for the purpose of altering, sustaining, or controlling the recipient's physical, mental, or mental state. These include some of the medicine that we usually take such as paracetamol and antibiotics.
But what do you think will happen if these drugs are taken more than the prescribed amount? Very good. Drug abuse will occur. Drug abuse is the process of using any drug for purposes other than those for which they are meant to be used or in excessive amounts. It is using any drugs for purposes of creating pleasurable effects on the brain. In short, too much use of these drugs may result to drug abuse.
Okay, learners, what are those prohibited drugs that are common to us? Again, what are those prohibited drugs that are common to us? Very good. There are 7 kinds of prohibited drugs that are common to us or in our community, and these are the following: stimulants, depressants, opioids, hallucinogens, dissociative, inhalants, and cannabis. Stimulants speed up our body process and increases the user's level of alertness. Opioids are powerful painkillers that produce a sense of euphoria in users, while depressants slows our body process, and this includes alcohol and barbiturates. On the other hand, hallucinogens cause our body to hallucinate. An example of this are ketamine, magic mushrooms, and LSD. Dissociatives, a drug that interferes the brain receptors for the chemical glutamate, which plays a role in cognition, emotionality, and pain. Inhalants can cause brief feelings of ecstasy. And last, cannabis, or commonly known as marijuana. Cannabis acts like hallucinogen, but it also produces depressant-like effect. It has a high potential for addiction.
Alright, did you get it? Very good. So now let us measure what you have learned from the topic that we have discussed. Prepare your worksheet or a piece of paper and ballpen. Are you now ready? Okay, very good. Now let us start. Here is the direction. List down the 7 prohibited drugs and describe its harmful effects to the human body when used abusively. Again, list down the 7 prohibited drugs, describe its harmful effect to the human body when used abusively.
Are you done answering? Very good. Then let us check your answers. The 7 prohibited drugs are stimulants, which speeds up our body process and increases the user's level of alertness. It can cause anxiety, paranoia, depression, heart failure, and stroke. Opioids are powerful painkillers that produce a sense of euphoria in users. It can cause constipation, liver damage, brain impairment, and cardiac arrest. While depressant slows down our body process, high risk of high blood sugar, increased body temperature, delirium, and death from withdrawal. Hallucinogens cause our body to hallucinate. Hallucinogen persisting perception of flashbacks, distortion cognition, anxiety, and paranoia. Dissociative is a drug that interferes the brain receptors from the chemical glutamate, which plays a role in cognition, emotionality, and pain. It can cause social withdrawal, hallucinations, and detachment from reality. Inhalants can cause brief feelings of ecstasy, loss of consciousness, brain damage, weakness, nosebleeds, and slurred speech. Cannabis, commonly known as marijuana, cannabis can cause depression, reduce sperm count for men, slowed reaction times, and impaired cause of time.
Did you get a perfect score? That's good news if you get a perfect score. But if not, then do not worry because we still have another activity. For your second activity, write down the prohibited drugs and describes its usage to our body and give some example for each drug. Again, write down the prohibited drugs and describes its usage to our body and give some examples for each drug. You can also answer the activities in your modules which are distributed by your ALS implementers. For the activity that we have answered today, please wait for your ALS implementer to retrieve it and record your scores.
We are already done with our discussion for today's episode. I hope you have learned a lot from us. But before we completely bid goodbyes, we will announce first the winner of our Tanong Ko, Sagot Mo.
So the winner of our Tanong Ko, Sagot Mo is Cheryl Abordo from Burabod, Biliran with the correct answer, drug abuse. Congratulations again to Cheryl Abordo. And because you are the winner for today's Tanong Ko, Sagot Mo, you will receive 50 pesos worth of load as your reward.
Another episode has ended. I hope you have learned new knowledge from our discussion. I am teacher Jonald Jake Escuton, who will always remind you to keep on listening to Als Radyo Eskwela every Mondays and Fridays at exactly 11 a.m. in the morning and only in 103.9 Radyo Natin FM Naval.
And I am teacher Ruben Igay, who will leave you saying that everything is good in moderation, but using it too much might result to complications. Let us enjoy our day ahead, and this is Als Radyo Eskwela.
Ang Dibisyon ng Biliran Alternative Learning System.